guys, I'm going to show you an exercise called a down dog plank. This is modified from a yoga position and it's good for patients with low back pain. I like to use this exercise after I've taught deep breathing and core stability activation. So first I'll show you what the exercise looks like. You want to start from a high countertop or a raised treatment table. So the patient's hands are going to be placed on the table and they're going to back their feet up just a little bit. You're going to start with an anteriorly tilted pelvis, and then the patient is going to move their weight posteriorly, so it will look like this. That last position is called the down dog position, and in that position there's a posteriorly tilted pelvis, and you're getting a lot of good lumbar and thoracic mobility and lengthening. You're also getting a good stretch to the calves and the hamstrings, and a stretch to the shoulders as well. This helps the patient to learn what a posterior weight shift feels like. And once they get the idea of the exercise, I like to add in deep breathing. So you're going to take a deep breath in on the upward movement and then a deep breath out during the downward movement. And you can also add in some transverse abdominis activation. So the patient should tighten their core while they're performing it. So you're going to take a deep breath in before down, so it goes like this. And then activating the core all the way, and taking a deep breath in on the way back up. I really like this exercise for patients with low back pain, especially older patients that may be a little stiff. This is a good exercise because they can do it in standing and they don't need to lay down to do the exercise. So once the patient gets a good idea of this, you can make it more difficult by lowering the surface of the table.